Chairman, by really thanking you very, very deeply from the bottom of my heart. Nikwambie tumeshukuru sana kuwa na nyinyi siku ya leo kama Safaricom Foundation na M-Pesa Foundation kwa kuja hapa kuanzisha mradi wa maana sana katika hii hospitali na katika hii sehemu ya Embu County. Nataka kukushukuru kwa sababu last year nilianza safari yangu ya kuongea mambo ya hii hospitali na Safaricom Foundation na M-Pesa Foundation huko Nairobi. Tulikuja hapo last year, actually early, I would say mid last year. Tukaongea na Eunice na Karen na nikawaambia niko na shida kubwa sana katika hii hospitali. When I became governor nilikuja hapa nikakuta maternity iko ndogo sana, vitanda ni 6 na nikaambiwa na madaktari kuna shida kubwa sana. And when I came to you, Chairman, I want to thank you kwa sababu when our project proposal ilifika kwa meza yenu, mlionelea ni vizuri mtusaidie kama watu wa Embu County na hii project ya 50 million Kenya shillings. Asante sana.
The reason why we are here essentially is because the Safaricom Foundation and M-Pesa Foundation has put a premium on health pillar and particularly maternal and child health. The maternal mortality rate, an average for the country, is about 355 for 100,000 live births. The target for the world is 70 maternal deaths per 100,000 live births. So the contribution, the small contribution that the Safaricom and M-Pesa Foundation want to make is to ensure that the number comes down. 355 is too high. No woman should die in the process of giving birth. We are putting in between 45 and 50 million to do the following. Number one, we will have an antenatal ward. We will have a postnatal ward. We will have a newborn unit that is completely equipped. We shall also have an operation theater that is fully equipped. There will be a waiting bay, a reception area, and an office for the nurse in charge. We also want to have a pharmacy that is specifically for a maternity ward. We expect that this work will be done in 6 months, 24 weeks. And therefore, if the contractor goes according to that schedule, we should be able to hand over in October, latest November, to the county hospital.
The situation which has been on the ground, ideally we have got a small maternity whereby we can be able to accommodate the antenatal mothers and the postnatal mothers within the hospital. We can accommodate only 8 mothers at a go. If we get a bigger number than that, then we shall have to refer some of the patients from here. One of the challenges we have been having, especially during antenatal period, we do not have a room where we can be able to accommodate the antenatal mothers who are having the complication. One of them being high blood pressure, eclampsia, or pre-eclampsia. We cannot be able to manage the patients here. We usually refer the patient to Embu level 5. Another issue is that a mother may come with anemia in pregnancy. Ideally, you are supposed to manage that mother within the hospital. You elevate the HB, and then you can be able to release the mother home as they await for the delivery. But we cannot be able to do it here simply because we do not have the what it requires as a facility for them to hold them here. We do not have an antenatal ward whereby we can be able to observe them for a week or 2. Another issue, if we get an obstetric emergency, we are not able to handle them here because we do not have an ambulance which is attached to this hospital. The ambulance which is being used in Kianjakoma, it is also being used in other facilities, making it a little bit hard for us to be able to effectively refer the patient for effective care. So there is some delay, which may cause also some harm either to the mother or even to the baby. Another issue, which is also a problem to us, is that a patient may come with APH, that is antepartum hemorrhage. We cannot be able to manage it here. Reason being, we do not have blood in the lab because we do not. Our lab is small. It doesn't have a blood bank. So we also need to refer this patient to another level. A mother may come with a complication even immediately after delivery, and also a few days after delivery. Those patients may not be able to be managed here. We refer them to Embu level 5. And our referral system being at a lower gear, the effectiveness of the services becomes a little bit hard, so that we are not able to give the care which is required immediately. One thing, allow me to thank the Safaricom, because I've been with them from the time they started their meetings up to where we are today. It will have a very great impact. Reason being, we have an antenatal ward whereby we shall be able to take care of our mothers who have got any problem in the hospital. We also have to detect any complications which may be accelerated by the pregnancy, and then admit that patient for better care. Number two, we have got a theater which will be equipped. So it will be having a good impact such that we do not have any fear that this mother may complicate. In case of any complication, we have a theater to take care of that. In case of any complication, even after theater or within that time the patient will be in the hospital, we shall be having a good referral system. That is, we shall have an ambulance attached to this place, so it will make it easier for the patient to get effective care. Another issue is, if we get the completion of that building, your maternity, it will be able to offset between 5 to 10% of the patients who are being referred to Embu. They will be attached here. The community, if we talk of the peripheral hospitals, like we have Karau Health Centre, we have got Kiriare, we have got Kairore, we have got Kanja, those Adimogoi, those patients who would have been referred to Embu, they will be referred here. And what does it mean? We shall have more funds coming to this facility. So we shall have it being improved economically, whereby we can be able to adjust or expand the infrastructure of Kianjakoma Level 3 Hospital. The other thing, it will be able to attract more human resource. What does that mean? We shall have more people getting embroiled into the facility, which will also create or improve their social status. Another issue, what will happen, we shall get more funds even from other NGOs, because our workload will be higher than the way it has been. So attracting more revenue to the facility, which will help us even to improve the status and the infrastructure of the hospital.
Today we're here at Kianjakoma for the official groundbreaking for a new maternal child health integrated facility. This hospital was built in 1941, so it is more than 80 years old. But the town has grown, the environment has grown, and therefore the demand for maternal and child health facility has substantially grown. So Safaricom Foundation, together with M-Pesa Foundation, and as part of Uzazi Salama, we are building a new facility at a cost of 50 million shillings. This facility will include an antenatal ward, a postnatal ward, a newborn unit for preterm babies. It will also include a theater for cesarean section. It will have an office for the nurse in charge and also a pharmacy. And the whole idea is to reduce the maternal and infant mortality, which is unacceptably high in this county and also for the rest of the country. So that is the reason why we are launching this project, and we hope that in the next 6 months, it will be ready for handing over to the county government of Embu.